Hello everybody, this is Braylon was Cheesy, and in this video I'm going to talk to you about types and uses of intravenous fluids, or we mostly call IV fluids. Yes, and there are various types of intravenous fluid, but I'm going to talk to you about the most common ones. We have the normal saline, we have the dextrose saline, and we have dextrose water or dextrose injection, and we have Ringer's lactate. Yes, and normal saline is a fluid that contains 0.9% of sodium chloride and distilled water. As we all know, our body is made up of approximately 70% of water. So normal saline is given to replace the fluid lost in the body. Maybe in cases of bleeding, a patient came to you with bleeding, excessive bleeding, you can give normal saline to because the patient has lost fluid, so you can give normal saline to the patient. It helps in replacing the lost fluids in the body. And then you can also give in terms of diarrhea and in terms of vomiting. People that have experienced diarrhea have lost fluids in the body, and also people that have vomited have lost fluids in the body. So you can give them normal saline to replace the lost fluids in the body. And then normal saline can also be used in irrigations of wounds. They can also be used in cleaning of wounds or dressing of wounds. If you have been to surgical wards where they do wound dressing in the hospital, many hospitals do use normal saline to dress or clean wounds. And then it can also be used in dilution of medicines. There are some certain drugs that when you've given a patient in certain amount in excess, you can give normal saline to dilute the effect or reduce the effect of the drug. So dextrose saline from the word dextrose, it contains 5% of dextrose, meaning 5% of sugar, and then it contains sodium chloride, and it also contains distilled water. Dextrose saline is given or is used in patients with hypoglycemia. It means patient with low blood glucose in the body or low sugar level in the body. You give them dextrose saline. I mean, not normal saline. You give them dextrose saline, and then it can also, because of the saline it contains, it can also be given to patients with diarrhea and patients with vomiting. Take note, you don't give dextrose saline to patients who are diabetic, and you don't give normal saline to patients who are hypertensive. I'll explain that in my next video. But for now, don't give patients with hypertension normal saline, and don't give patients with diabetes dextrose saline. Then let's go to dextrose water. Dextrose water or dextrose injection, as the word implies, dextrose, it contains purely dextrose, meaning it contains purely sugar. There's no electrolyte inside, there's no sodium chloride inside. It contains only sugar and water. It is given to patients who cannot take anything by mouth. They cannot take anything orally. Example is unconscious patients who have been on bed and cannot take anything by mouth or orally. You give them dextrose water. And dextrose water, we have 5% dextrose water, we have 10% dextrose water, we have 25% dextrose water, and we have 50% dextrose water, and then we have Ringer's lactate. Ringer's lactate is a solution that contains purely electrolyte. It consists of lactic acid, sodium hydroxide, sodium chloride, and potassium chloride, and distilled water. It contains purely electrolyte and is used in patients with acute blood loss or patients with burns or fire accidents or patients with hypertension. You give them Ringer's lactate. Take note, there are conditions that warrant you to give patients one or more of these fluids combined. Thank you for watching this video. Please don't forget to subscribe to our page and do well to share our posts. You can also follow us on Facebook, Instagram, and TikTok. Thank you.